Welcome back. On this session, I want to do an introduction to the clinical assistant licenses. So clinical assistants in Canada are a very valued professional, and usually it requires you to be a doctor. The only province that accepts clinical assistants that do not have an MD degree is in Manitoba. I want to talk a little bit about clinical assistants because there's a lot of confusion around it. And before I start talking about the clinical assistant licenses, I just want to give an overview about the profession. So what are clinical assistants? So clinical assistants are usually MDs that are trained outside of Canada, okay? MDs that are trained in Canada do not apply for clinical assistant licenses because they're eligible for full certification, unless they didn't do a residency in Canada. Now, you are required to not only have done medical degree, you're also required to have done at least 1 year of postgraduate training. Now, this postgraduate training can be done after your medical degree, but in most situations, they will accept internship that is done as part of a 6-year program. However, in most situations, they will tend to accept internships that were done as part of a 6-year program. It is important, however, that your medical school transcript outlines clearly that it was an internship and that it specifies the rotations that you did and for how many weeks they were. So there are specific requirements in regards to which rotations you should have done and how long they should be, okay? Now, these requirements might vary between provinces and practice-ready assessment programs, but it is usually the same. And for clinical assistants, which is the topic of this session, they are also usually very similar. So for most of the clinical assistant licenses, if not for all of them, you need to have completed 1 year of training, of postgraduate training, which may include internship, okay? However, that is usually not enough in its own. You will probably need to have done an examination as well. And I will talk about the requirements for each of the clinical assistant licenses when we talk about them. But in this session, I want to go over which of the provinces even have clinical assistants as a regulated profession, because it's not all provinces that have that as a regulated profession. So for example, in Ontario, clinical assistance is not a regulated profession. Because clinical assistant is not a regulated profession in Ontario, that means that there's no way for you to have a license in Ontario if you want to be a clinical assistant. That leaves a gray area where a lot of people that work in medical offices with other physicians will call themselves clinical assistants or will list on their CV as clinical assistants, and that is kind of okay because it's not regulated or protected term in terms of profession in Ontario. However, in some other provinces, you're not allowed to use the term clinical assistant if you don't hold a license. So, the provinces where clinical assistants are able to be licensed are Alberta, Manitoba, Nova Scotia, New Brunswick, and Newfoundland. It is important to highlight that in Saskatchewan, you can also work as a clinical assistant even though they don't have a license called clinical assistant license. There, it is called physician practicing in a limited scope of practice. However, you may look for jobs in Saskatchewan that offer clinical assistant positions, okay? Now, in Ontario or in BC, there isn't a license called clinical assistant, and therefore you can't apply for clinical assistant jobs. I would like to highlight that in BC, in British Columbia, recently, the associate physician license, which was before only for specialists with at least 2 years of training, now can be given as well for primary care associate physicians. Associate physicians in BC is very similar to clinical assistants in other provinces. The difference is that now in British Columbia, there's 2 types of associate physicians, and one is for people who have 2 years or more of training in a specialty, and one is for people with 1 year of training in family medicine or as a general practitioner. So in BC, clinical assistant may be referred to as associate physician in primary care. In Saskatchewan, they may be referred to as clinical assistants, but their license will be a license for a physician in a limited scope of practice. And then in Alberta, clinical assistants may be called clinical assistant or surgical assistant. That's only in Alberta. And then the other provinces, it's just clinical assistant license. And the provinces I'm talking about is Manitoba, New Brunswick, Nova Scotia, and Newfoundland. All the other provinces do not have a license for clinical assistant. So that includes, for example, PEI, Ontario, and Quebec. In those provinces, you do not have a clinical assistant license. So people who say that they are working as a clinical assistant are not regulated and therefore they don't have a license. Why have a license and why is that maybe of an advantage to you? When you have a license, you are bound to that college. Therefore, because it's regulated, they usually have a very defined scope of practice for the profession, which allows you to do certain things that you might not be allowed to do in Ontario, for example, because the physician might not be comfortable letting you do certain procedures such as physical examination or some assessments if you don't have a license. Now, it's important to highlight that no matter in what province we're talking about, clinical assistant licenses are non-MRP licenses. We talked about most responsible physician in a different session. So if you don't know exactly what a most responsible physician is, I suggest that you go back to that session to review. Just want to highlight, clinical assistants are not MRPs. Therefore, it does not count as independent practice if you're trying to close a gap. You cannot break a gap in clinical practice by getting a clinical assistant license, okay? It is important, however, to highlight as well that to get a clinical assistant license, you need to have had experience previously as a general practitioner. There's one exception, as always. In Alberta, you may not need to, but I'll talk about that when we talk about clinical assistant license in Alberta. The reason why I'm saying this is because even though clinical assistant license does not break the gap, you may need to have had prior experience as a general practitioner back home to be able to get a clinical assistant license. And there is a limit of years that you can have been away from that independent practice to still be eligible for a clinical assistant license. So therefore, if you wait for too long, or if it's been too long since you have had any independent practice experience, you may not be eligible for a clinical assistant license anymore. So it's important to take that into consideration, even if you find that being a clinical assistant will fulfill your professional objectives, you need to make sure that you don't let that time expire or the gap be too big. I always say that we should try to stop the gap. And when you apply for a clinical assistant license, you're not stopping the gap. However, you are using that recency of practice that you have in regards to independent practice to get that clinical assistant license. Once you get it, you're able to continue on it, even if it becomes far away from the time when you were doing independent practice, okay? So this is just a short introduction for clinical assistant licenses. We'll go now into detail for each of the provinces that I mentioned. We're going to start in BC for associate physician primary care, and then we're going to move along all the way to Newfoundland, okay? I will see you on the next session.